Hello, my name is Kristi Highley. I'm one of the dietitians at Fresh Start Bariatrics. We're going to spend some time today and talk a little bit about the nutrition facts label. Why is the nutrition facts label important for the bariatrics patient? Because it has a wealth of knowledge of the composition of the foods. Now you'll find the nutrition facts label on every packaged product at the store. The only time you won't find it would be on fresh produce and fresh meats. Again, the reason why we want to look at that is many reasons. We want to look at the composition of foods. It's really important, regardless of the procedure that you should have, with your stomach being so small, and also that we understand the foods that we're selecting. And the nutrition facts label will help us make really informed decisions on the foods we select at the grocery store. Because again, the foods that we let drop in our grocery cart at the grocery store is going to fill our cupboards and refrigerators at home, and it will set up for a pretty nice controlled environment. And I think in the education that some of the patients have with the dietitian, we talk a lot about proteins, we talk a lot about sugar, we talk a lot about fat, and there's a lot of that information that you can find right here on the nutrition facts label. So what we're going to do is we're going to kind of go through and break down the different parts of the nutrition facts label and how you can utilize that at the grocery store. Now, one of the first things you want to do is on the nutrition facts label is kind of look at the serving size, because the serving size sometimes can kind of be misleading. Sometimes the manufacturer will actually make the serving size smaller than we might typically think. It's not unseen that a pot pie, for example, might actually have as a serving size a half of a pot pie. And we might look at the label and think that we assume that that's for an entire pie. So it's really important to kind of look at the nutrition facts label and compare it to the portions that you might be having on your new special diet. In this instance, the serving size is 6 crackers. So all of this information on the composition of that cracker is based on 6. So if, for example, your dietitian has worked out a plan where perhaps you can have 12, well then of course you're going to double all these numbers to correspond to double the amount of that serving size. We also want to look at the calories. The calories, again, your dietitian may estimate some caloric needs for you, and it's not really on an individual basis. Your calorie needs, your protein needs, your carbohydrate and fat, they're determined or calculated on an individual basis. So if you don't have those, you might want to work with your dietitian to get an idea of where you should be. However, you can fall back on what we call the percent daily value. That's kind of just a general percentage, actually based on a 2,000 calorie diet. And if you look down here at the footnote, you'll see that they discuss that a little bit further. And the percent daily value just gives you a rough estimate of the percentage of fat, carbohydrate, protein, even vitamins and minerals in that particular serving. But again, it's based on a 2,000 calorie diet. Now your diet may be 1,500, it may be 1,200 calories post-op, or perhaps it's a little bit more. So you do have to adjust it on an individual basis. But it does give you a gross idea. For example, what I would recommend as a general rule is that we want most of the nutrients that we want to limit. The nutrients we'd like to limit would be, of course, the fat, because again it could have some issues with dumping. Again, in relationship to cardiovascular, fat is also a concentrated source of calories. So this would be a nutrient we'd want to reduce. So we would look at maybe 5% or less would be a really good item for you to purchase if that was low. Another nutrient that we'd want to limit would also be our sugars. Now there's no percent daily value for sugars because that hasn't been determined yet, but a good general rule of thumb is if you can get a product with sugars less than 10 grams, that would be really good. Now again, we have to individualize that based if you have a history of diabetes or whatnot, but that would be a good way to start. On the contrast, some of the nutrients we want to get more of would again be protein. We've talked about the benefits of protein as far as especially post-op and healing after surgery. Your immune function is really important. So those are some of the really important reasons. So again, protein would be something we really want to look at on the nutrition facts label also. And again, here you can see that it has 3 grams. We often, as a general rule, will recommend 60 grams of protein for women and 75 grams of protein for a gentleman. However, again, that can be individualized based on the person's medical history and so forth. So that's also really good, important information to know on the nutrition facts label. And then not to leave out too, you can see here in the orange, we have some vitamins, vitamin A, calcium, vitamin C, and iron. Again, regardless of the procedure, they're all restrictive, and so there's a risk for some nutritional deficiencies. We do encourage multivitamins and minerals, but it's also good to get these nutrients and food sources also. So here you can see they have the percent daily value. So that's going to be also very important when we're talking about the nutrient composition of foods and trying to find foods that are very nutrient dense. Because if you think of your stomach being significantly smaller, every bite is really going to count. So you want to get as much nutrition. So although it's really good to get something low in fat and low in sugar, we also want to make sure that it has some nutrition in it also. So that's where we kind of look at the whole picture. There's actually a lot of information on the internet under FDA. If you can go FDA and look at the food label, the act has some really good articles if you want to know a little bit more in depth as far as nutrition facts labels. However, we may do some more video clips specifically talking about fats on a nutrition facts label, carbohydrates, and all the other nutrients. So with that, I think we'll close. Thank you.